to my channel. This is Dr. Victoria Givens, your board-certified facial plastic surgeon and owner of Givens Facial Plastic Surgery in Austin, Texas. Today, I'm talking about the earlobe piercing. So stay tuned to find out everything you need to know, and don't forget to hit that subscribe button and like below. Let's get going. All right, so here we go with the topic of the day, what to know when having your earlobes pierced. First and foremost, it's important to be prepared before your earlobe piercing session. There are a few things to know, especially if you're going to have your ears pierced at my practice, Givens Facial Plastic Surgery. For starters, you should bring a pair of lightweight studs that you're okay with wearing 24/7 for a full 6 weeks. The studs should be hypoallergenic, meaning they're made of a material that creates minimal risk of causing an allergic reaction. Now, most hypoallergenic jewelry contains pure metals, including platinum, gold, titanium, copper, stainless steel, or sterling silver. If you have a metal allergy to, say, nickel or something similar, your best earring option is a product made from either titanium or medical-grade plastic, as these are the least reactive of the hypoallergenic metals. It's crucial to keep your newly pierced earring studs in place for a minimum of 6 weeks. Why? Is that really necessary? Yes, because that's how long it takes your newly pierced earlobes to actually heal. Removing the earrings earlier than this time period runs the risk of the holes closing back together, which means another trip to see your favorite doctor, me, for a new piercing session. There are quite a few options when it comes to the techniques used to pierce the earlobes. At my office, I use a special needle to both pierce the ear and thread your stud back through simultaneously. This gentle approach minimizes trauma to the earlobe tissue and allows for quick, efficient healing. Now let's go through my top 5 most commonly asked questions when it comes to ear piercing from my patients. Do I need a numbing shot prior to ear piercing? The answer is no. The numbing shot requires 2 needle sticks as well as a stinging sensation from the numbing medicine being injected per ear. The actual piercing procedure only requires a single needle stick per ear. So you do the math on that one as far as pain goes. Do I need topical numbing medication applied prior to ear piercing? Again, the answer is no. While the topical medication numbs the outer layers of skin on the back and front of the ear, it doesn't numb the inner or deeper earlobe tissue. Thus, you still feel the needle stick as it passes through your earlobe, even with numbing cream applied. Do you use an ear piercing gun? No, I do not, and for good reason. Piercing guns can cause significant tissue damage. These guns use very aggressive blunt force trauma to force blunted earring ends or studs through the earlobe tissue. This can be quite painful, and worse, it can cause unnecessary swelling and potential scarring, which we want to avoid. Do you pierce children's ears? Now, this is very dependent on the maturity level of the patient. Children that are mature enough to sit still undergo 2 separate needle sticks and follow aftercare directions are appropriate and great candidates for an earlobe piercing at my office. However, those who are afraid of needles, cannot quite yet follow directions, and are not able to sit still or do aftercare will not be offered an earlobe piercing at Givens Facial Plastic Surgery. And finally, what do I need to know about recovery and post-care? A few things. The earlobes and earrings can get wet in the shower. They should be gently patted dry after. The earlobes should be cleaned front and back, morning and evening, using gentle soap and water. If crusting or scabbing occurs, apply Q-tips dipped in hydrogen peroxide along the edge of the studs. Ointment such as Aquaphor is okay to use as needed, or if a really hard to remove scab or crust develops. You need to avoid swimming in lake water and getting in hot tubs for at least the first 2 weeks or longer if there's remnant crusting and scabbing or potential for infection. Sleep on your back as much as possible. There's no need to rotate your earrings. Call your provider if there's concern for an infection or allergy. And finally, most important, don't forget to enjoy your newly pierced earlobes. If you found this helpful, I encourage you to watch my other videos on earlobe repair and reduction and treatment options as well as recovery. As always, we know that personal transformation is one of life's most meaningful journeys, and Givens Facial Plastic Surgery offers a comprehensive, customized approach designed to reveal unrivaled yet natural aesthetic results for those who refuse to settle for anything less than the very best. Thank you for watching. You can find all of my office's contact information and social media platforms below this video on my channel. Don't forget to subscribe, and I'll see you soon.